I recently had a session where a patient expressed suicidal ideation to me. He is currently living in crisis housing, and he was just feeling extremely depressed. He's also a patient that uses cocaine, so I know that when they use cocaine, it usually takes you like it increases nervous system stimulation, but it also causes like a huge depletion, which can lead a patient to fall into severe depression, which can also lead to them becoming suicidal. And I feel like he had been on a path where he was trying to go into detox, and he sort of fell back into his pattern of using cocaine. And I think that's also brought on the significant amount of depression that he was feeling. And I would say the feelings that it elicited in me was that I sort of felt like helpless. Like, how am I going to help him sort of come into the realization that he has a lot to live for, and that he can go into detox, and that he can build a better life for himself once he really stops using drugs and has like a some stability in his life. There's also a program where as soon as they become sober, they can learn a skill. They can become a mechanic, a CNA, or, there's just a number of other skills that he can learn so he can have a productive life. So I was just trying to tell him that he has so much to live for. He has his wife, he has his children, he has his grandchildren, and that we really, need to work on going into detox and becoming sober so that we can enroll him in this free program so that he can learn a skill and build a life for himself, and so he can have some stability in his life. And I kept trying to tell him this in order to encourage him to be better, I just really wanted what was best for him. And I was really trying to encourage him to want better for himself, because I believe that anybody can come back from anything. I really truly believe that anyone can come back from any sort of trauma, any sort of drug addiction, that they can build a better life for themselves if they really, really put the effort in to going into detox, being clean, going into therapy, participating in these programs, because a lot of them are free. So I felt that it's just what I was trying to convey to him, but I'm not really sure that I broke through. And I would say that I feel like I need more training in terms of like learning how to manage those type of crisis situations, because I have not been in too many of them. I'm really not sure, like, if he did not express to me that he had a plan when I asked him, but especially for patients that already have a plan and that are set and everything like that, how to properly manage that. I feel like I would need more training on how to properly manage that circumstance.